After getting out of prison, I started looking around at my options for an apartment, and nobody would accept me. Nobody would even take the applications or finish with a phone call, basically, when they heard about the felony.
I remember when I first became homeless thinking, I'm not going to let this happen to me. I've got to find a way to get out of this. But that's a lot easier said than done, because the longer you are homeless, the harder it is to escape that.
I was told I would be stuck in that mission for another 9 to 17 months, and I couldn't do it. And then Rosalie with HUD-VASH, she said, we're getting them out of here. And so she made the arrangements and had me come up here.
On any given night, there's over 37,000 veterans homeless around the country, and quite a few more than that over the course of a year. What makes HUD-VASH the gold standard, the thing that is most likely to get veterans housed, keep veterans housed? It's really two things in particular.
HUD-VASH is a unique collaboration between two federal agencies. HUD provides housing choice vouchers, which is rental assistance in the form of what's typically referred to as Section 8 vouchers for homeless veterans. VA partners that financial resource with clinical and case management services for those veterans. And that way, VA supports the veterans in getting housed and keeping their housing over time.
You do not have to be literally on the streets in order to get support from the entire range of VA's homeless programs. But for HUD-VASH, to be eligible for the program, you either need to be literally homeless or at imminent risk, which is defined as facing eviction within 14 days.
When I got out of prison, I went and I stayed with my sister in one of her spare bedrooms. It was with her and her family, so I knew, that wasn't a permanent place. But I didn't realize it would be so hard because nobody would accept my applications for an apartment.
The HUD-VASH program, when we are working with veterans, no matter what the challenges may be for housing, we work with the housing authority and landlords to be that middleman between the veteran and the landlord, so the landlord has someone to call if they feel there's a problem or an issue. We also kind of sell the program. First of all, we sell it as the fact that you're housing a veteran, which is an honor. We sell the fact that the program is all-encompassing, meaning that we surround the veteran with staff, social workers, nurses, doctors, anything that they need, we're going to provide. And we sell the fact that the HUD part provides the money. So for a landlord, that's a very safe bet. For every veteran, we want them to have safe, stable housing. And Christina wanted someplace with a locked front security door. It made her feel safer as a single female, and so we were able to get her in here. So that's something we always take into consideration is need. Whatever they need, we do our best.
Having housing, it makes you feel more independent, and I want to be a productive member of society. And the VA has just done so much for me, mentally, emotionally, physically, and putting a roof over my head. You can't ask for more than that. Even though the parole board says that you can be trusted out in society to be a productive member, nobody looks at you like that. And it was so humiliating to be rejected so much, but then when you walk into the VA, they just treat you like your family walking in. And they don't judge you at all for anything. To be homeless or to be poor, they don't care. You're still a veteran. You're one of them.
HUD-VASH vouchers can be used in a variety of settings. Tenant-based vouchers, and those are the bulk of the vouchers that our veterans use, are used in regular apartments or homes. So the veteran shops for a vacant unit and they use their voucher to pay for that unit. But we also have settings where veterans receive a lot more support. These are referred to as project-based HUD-VASH settings. Sometimes those are on VA campuses, sometimes they're in the community, and usually these sites have additional supports available.
I basically just survived enough, and then I would come back into town to get fuel and supplies, and then I'd go back up because I just had enough of people. And then after quite a bit of time of that, it was time to come back down to get my leg healed. I kept getting MRSA infections in my leg.
When I met Tom, he was in our residential rehabilitation treatment program on campus to take care of his leg, to take care of his medical situation. And during that time, that's when I connected with him to refer him to Freedom's Path. Freedom's Path is HUD-VASH, project-based housing on Vancouver campus. When we think of a potential referral to Freedom's Path, one of the things that we're considering is, could they really benefit from being close to services? Vancouver campus has a variety of supportive services for veterans. There is substance abuse treatment, prosthetics, outpatient mental health, optometry, podiatry, and they have primary care, which is actually right across the street from Freedom's Path. So when we're trying to identify folks who might be a good fit, we are considering, what does their ambulation look like? What's their transportation situation? Do they have the finances for a bus pass? If they don't, living at Freedom's Path can remove that barrier. So if they have a variety of medical treatment or they need to see a primary care provider more frequently, it could be beneficial for them to live at Freedom's Path because they're so close to services.
Coming into here, I was able to take care of my medical problems. I could walk to everywhere I needed to go, and it made all the difference in the world. It made me feel like I was accepting responsibility again because I wanted to contribute to society. It's very profound. It'd almost make you cry because you don't think about what you've been through to get there. You're thinking how lucky you are to have what you got right now. And what are you going to do after you've met this point?
With everything in HUD-VASH, whether it's about locating housing and choosing the place they want to live, accessing the services that can be provided by the VA and by community partners, it's always the veteran's choice. The key is that the VA is here to support and partner with the veteran in helping them meet their needs and work toward whatever their long-term goals are.
My counselor in the drug court treatment program told me to go to the VA, and thank God that she did, because that is where my life started again. I had a hernia at the time that I'd had for 3 years, while I was homeless. And following the surgery, several people had come into the hospital room, and they stood there at the end of my bed, and they said, "Thank you for your service to our country." And, just hearing those words from those people made me feel like, a person again. Those words changed everything.
You can see the progression of Brett from the time that he was homeless to the time that he was in HUD-VASH to the time he graduated HUD-VASH and then became a peer support specialist. That is the goal of HUD-VASH, is to get the veterans so that they're sustainable in life and that they achieve their goals and live a satisfying life. I think everybody that works in HUD-VASH has something in their heart for the veterans, and I see that all the time with Brett. Because of his experiences, he knows what the veteran is going through, and that's the beauty of peer support. They're willing to let you help because of the fact that you're a peer, you're a veteran, and they trust you.
I just felt a responsibility to be a part of helping other veterans, even though everybody has their own story behind what's caused them to become homeless or whatever. It's nice being able to help somebody find how that story can, end up making them a better person. And that was going to be my way of saying thank you, to the VA and HUD-VASH for everything that they've done for me. Because without them, I don't think I'd be here right now.
For a veteran seeking HUD-VASH assistance, there's a lot of pretty simple ways to get more additional information. One is to walk in or call their local VA medical center. If there's not a nearby VA medical center, but there's a community-based outpatient clinic, or a community resource and referral center. Those are one-stop shops for homeless veterans that exist in many of our communities across the country. Another is to call our national homeless hotline for veterans in need of housing support and assistance. Any of those avenues, veterans will be directed to the right resource to assess whether HUD-VASH is a good fit for their needs.